I'm Dr. Sharath, consultant interventional cardiologist and vascular specialist, Sunshine Heart Institute, second batch. On this World Hypertension Day, World Hypertension Society has given a theme as healthy heartbeat and healthy blood pressure. Hypertension is the most common risk factor for all cardiac disorders across the world. And in fact, it is known as a silent killer, which causes many secondary complications if it goes undiagnosed. And hypertension is the most common medical disorder which we see in our clinical practice. So what is hypertension? So in common language it is known as high blood pressure. So generally blood pressure is it's the pressure which is exerted by blood column on blood vessel walls. So only when there is a pressure within the blood vessel, then the blood will perfuse to all organs, and all organs will receive all metabolites concerned with their metabolism. So that's why blood pressure is required for a human being. But in case the pressure goes beyond recommended value, so we call it as an hypertension or high blood pressure, which is commonly known as. So when we label a person as hypertensive, see, if a person had a blood pressure of more than 140/90 in 3 or more occasions, and it will be better if it is a home recording rather than a clinic recording. So in such a scenario, we label that person as an hypertensive, and we have to treat all such patients with the antihypertensive therapy. So why we have to treat all these patients? Now what happens if you don't treat these patients? If we don't treat hypertension, over a period of time, all organs will get affected by this high blood pressure. So which results in brain strokes, heart strokes, and sometimes even kidney failure, and sometimes dysfunction of retina, which leads to visual loss, and sometimes it leads to rupture of major blood vessels and minor vessels in the brain. So these are the secondary complications which comes if you don't treat hypertension. So for these complications to occur, it takes minimum of 5 years to sometimes up to 2 or 3 decades. So these complications happens after decades, not within a year, within a span of year or month. So to prevent these complications which comes after few years, we have to treat hypertension from the day we diagnose. And how we treat these patients? So there are 3 treatment options for these patients. So one is medicines, second is lifestyle modification, and third is physical activity. So among the 3, the most important is lifestyle modification and physical activity. So in lifestyle modification, if patient is a smoker, so he has to quit smoking. That itself will reduce blood pressure by 5 to 10 millimeters of mercury. And if in diet, if they consume more salt, they have to reduce salt intake to less than 5 grams per day. This reduction in salt intake itself will reduce around 5 millimeters of mercury blood pressure. And then is physical activity. So in physically inactive persons, blood pressure tends to be on higher side. So if a person do regular physical activity, there will be at least more than 8 to 10 mmHg of reduction in blood pressure with a regular physical activity for 3 months. So that's why these 3 non-pharmacological modalities are very important in treating hypertensive, which are most often neglected by patients. And next comes the medicines. So medicines, there are 6 to 8 groups of medicines in hypertension therapy. So depending on patients' other clinical problems, we select medicine and we give medicine. But after starting medicines, follow-up is very important. So after starting medicines, the full effect of medicines comes generally after 7 days. So patient has to come for follow-up after 7 days to check whether pressures are under control or not. So the control means for every patient will have a target level of blood pressure depending on his clinical situation, clinical conditions. So for target blood pressure for routine patient is less than 1, to keep blood pressure less than 140/90. But in patients with diabetes and renal failure and patients who had already coronary artery disease, that is heart attacks, we tend to keep blood pressure below 130 and 80. So we have to achieve these goals when we use medication on patient. To achieve this goal, so there should be a regular follow-up checkups, initially once in a week to 10 days, at least for 3 to 4 visits, followed by regular checkups once in 3 months. So once we start medication, we recheck after 7 to 10 days. If the pressure comes under target level, so we'll continue the same medication. We'll ask patient to come back after 3 months. But if the pressure is not under control, then we raise the dose of medication and we'll ask them for follow-up for after 7 to 10 days again. So whenever the pressure comes under target level, then we'll ask the patient to come for 3 to 6 months follow-ups. So most often what is happening with patients is they'll come for the first time. Once hypertension is diagnosed, we start medication, but usually we are missing follow-ups in such patients. So, but follow-up is very important. After starting medication, whether the pressure is coming under target level or not will be known to physician only when patient comes for follow-up. So follow-up should not be neglected by patients, especially when hypertension and also any other chronic disorder is concerned.